We selected Erica to be ambassador for Fibroid Fighters because she represents very typical situation. Erica personally suffered from fibroid. She had the symptoms, she had her journey. He tried to get help. She wasn't passive, she was very active looking for help. And her journey, her story is very typical for a vast majority of fibroid patients. What differentiates Erica, that she takes very active position and she's fighting to get the answers for her health, for her future, for her future children. And she makes a very important point also to share the story, to share the journey with other people, to make their journey easier. So I think Erica represents exactly what we're looking for Fibroid Fighters, and I'm happy she joined us.
Well, I feel like it was really a natural fit. Myself working on a film called Red Alert: The Fight Against Fibroids, and then being approached by the Fibroid Fighters organization, it just kind of felt like it was hand in hand. I really appreciated your passion for helping women, knowing that 80% of African American women will be diagnosed and suffer from fibroid tumors by age 50, and 70% of all women have fibroid tumors. It just seems like it's something that both of us really truly can dedicate ourselves to in bringing awareness to these issues that plague so many women. So becoming a fibroid fighter was just a natural decision for me, and I'm really thankful to be a part of it. I think that through the work between my documentary and the work as an ambassador for Fibroid Fighters and the mission that you all have, that we'll be able to help millions of women, countless women, with the issues that they struggle with daily, monthly, hourly, because there's so many, and we all need help.
It's interesting that we called our organization Fibroid Fighters, not fibroid educators, not fibroid help or hotline fighters. I think based on your experience, you realized you need to fight for your health because there's so much, it's so difficult to actually get the right help. And there's so much of unknown in the general population, although it's very well known in medicine. So for me, Fibroid Fighters started from clear understanding that fibroids are curable disease. It's very common and it's curable. Isn't that amazing that we can do something to help millions of patients? Actually, 40 million women suffer from fibroids. 10 million severely symptomatic enough to seek treatment, to seek help. Unfortunately, African American women have a little worse situation. The fibroids start earlier, they grow faster, and they're more symptomatic. Just to give a comparison, between ages of 18 to 30, 26% of African American women already have fibroids versus 7 whites. Between ages 35 and 40, 60% of African American already have fibroids versus half white, 30%. And obviously by age of 50, 80% of African American women have fibroids, and 70% whites have a fibroid disease. Interesting fact is that because fibroids grow earlier and faster, the symptoms much stronger, especially bleeding.
Yes.
That leads to anemia.
Yes.
So it's something that impacts every day: lack of energy, inability to function, and the treatments that African American get, unfortunately, maybe it's related to size or other things, have more complications.
And when I think about, you mentioned some of the symptoms and also, how common it is. when I think about my own journey of being diagnosed in 2008, the doctor at the time told me that I had 6 or 7 fibroids. Now, this was after I had seen my original OBGYN who tried to fit me for an intrauterine device, an IUD, birth control, and it was so painful. And I could not understand why it was so painful. And so she dismissed it, and so I sought out a second opinion. At that moment, I started fighting. I sought out a second opinion, and that's when I was diagnosed with fibroid tumors. And unfortunately, at that time, it was unknown. UFE procedure was not as known as it's becoming and as it will become in the future. But the only option I was given was no option. I was told that I just need to live with the pain because I had a fibroid within my uterine wall, so the doctor didn't want to do surgery at that time. Well, little did I know that a few years later, that they would grow from 6 or 7 to 22 fibroid tumors. And at that point in time, I was given very little options as to what my treatments would be. But during that time that it was growing from 6 to 22, you mentioned the different symptoms, the pain, the pelvic pain that would just come out of nowhere. I could be walking in the mall, I could be sitting at home on the couch and just have pain or just kind of flinch. My husband would often say, like, "Are you okay?" I would just have a flinch of pain. And then we begin to normalize that pain because it continues to happen over and over again. I remember, wearing heels. I used to love my stilettos, Dr. Yan. I would love wearing high heels, but the more pain that I experienced from fibroids, I had to give up my heels. And so, I'm in a few heels now, but, for a woman, who likes to dress up, and, that was very difficult for me. Frequent urination, not being able to do something for a full hour because I had to account for bathroom breaks all the time. And that just became very difficult, very embarrassing. We're supposed to drink water to help things flow through our bodies. Well, I had a fear of drinking too much water, and in fact, I still do, because I know that it will mean that I'll have to run to the restroom more often, and it just becomes a real inconvenience, and just the ongoing physical pains that I have from the treatments that I've had and from the fibroids being in the places that they've been have truly, it's disheartening, and it's not the quality of life I feel that women should be living at all.
I know that you were fighting for your health, and you went to different doctors, and you had treatments and surgeries. Maybe you can describe the journey, and then we'll talk a little bit more.
Absolutely.
What could have been alternatives.
Absolutely. When I saw that first OBGYN that diagnosed me, we tried a few things. She described to me a little bit about what fibroids were. She didn't go into great detail, but some of the options that she offered to help with the bleeding was freezing my cervix. I know that sounds really scary because it is scary. She froze my cervix and I'm really not even sure why it was done, but it was supposedly to help with my periods being so heavy. We also tried the Lupron Shot, and I didn't fully comprehend what the Lupron Shot would do, and at the time I was about 27 or 28 years old. So I just heard that this shot is going to stop your period or make your body think you're going through menopause. And, at the time, I just didn't give a whole lot of thought to any long-term effects that might have, or, we're combining this with the birth control that I'm taking and everything else, or what it could be doing to my body, or a type of estrogen imbalance that it might cause because I still had the tumors inside me. So we tried those options. And I think after that, there was quite a few years between where I literally didn't have any treatments. The only thing I was doing was suppressing the pain and suppressing the bleeding the best way I could. I was taking ibuprofen. I've been on 800 milligrams of ibuprofen for pain for many years. Which is, I understand that a lot of people get that type of prescription after surgical procedures to assist with pain. But that is something that became the norm for me. So I was basically treating it with over-the-counter drugs or prescription drugs for many years. Fast forward to 2012, and And that was the first time I believe I landed in the emergency room because I thought it was hemorrhaging. And so going to the emergency room was a very scary experience. I went and I didn't understand what was happening to my body, and I felt like the ER staff, as skilled as they were, and I know they were skilled staff, they couldn't fully describe what was happening either. What had happened, Dr. Yan, is that I was also developing endometriosis along with those fibroid tumors that were growing exponentially. So the endometriosis, of course, they see a mass. They see things through ultrasounds and sonograms that they couldn't explain. So they just told me to follow up with my OBGYN. At the time, and just being truthfully about the situation, I was living in Los Angeles. I was an entrepreneur. I wasn't doing that great financially. So having the healthcare system available to me to get all the treatments that I needed just wasn't there. It wasn't an option. And so I just basically self-medicated at that point. And so for 2 years, I continued just to take the ibuprofen. I could probably go through a bottle of Advil in maybe 4 days. And I just kept up with that routine until 2014, when I was able to get a healthcare plan. And I found a physician who was a fertility specialist as well. And she suggested that I have a myomectomy. So that was my first myomectomy. The experience was, when I think about it, it still kind of rattles me a little bit. I'll tell you about my pre-op. My mother, who also had been diagnosed with fibroids when she was younger, had a hysterectomy. During her time, she's in the baby boomer generation, hysterectomies were kind of handed out, just back to back for people. And so my mother and actually her sisters as well had hysterectomies by the time they were 35. And so at that point, I felt like I was on borrowed time. Well, my mother went to my pre-op for my myomectomy with me, and the doctor was telling her, I really think that I can save your ovaries, I can save your uterus, but we've got to get the fibroids out, and I know there's quite a few because I can't see them all on the ultrasound. Well, my mother, bless her heart, she said, well, that's great, but if you have to take her uterus, take it. Because that's all she knew. That's all she understood. And she wanted to make sure that I was in no immediate danger of death or anything over hemorrhaging. And so she said, if you got to take it, she just kept saying that. And I'm like, Mom, no. She said she can do this without a hysterectomy. And so, so she, kind of backed down with that. But she had my best interest at heart. But it's just only a example of how many women believe that that's their only option at the time. So at the point of my surgery, the doctor ended up removing 22 fibroids from my uterus, and she removed some endometriosis as well, and also a cyst on my ovary. In recovery, my mother came back to see me, and then my father, and then my mother again, and we were speaking, and my mother said that I immediately just turned white. She said, and which is not easy for an African-American woman. So I immediately started losing color and I lost consciousness. And the next thing I knew, I woke up in the intensive care unit. And it turns out my heart rate had increased, my blood level had dropped drastically, my blood pressure had dropped drastically, and I was in intensive care for 7 days. It was a very scary experience. My parents were there the entire time, sleeping in the room, because we just didn't know what was going to happen. And every time they tried to get me up to try to see how far I had progressed, I fainted. And so after 7 days, I was taken to a regular room. I also had an issue with taking a blood transfusion. I was fine with a cell saver, but I had been raised in a religion that didn't believe in blood transfusions at the time. And so we kind of felt that was a very last option. So eventually my blood level did start to rise on that 7th day. And the recovery period, Dr. Yan, was very long. I had to quit my job in that respect and go on short-term disability because I could not endure the drive from where I lived to the location where I worked. So I suffered financially from that, and it just took, I would say, probably about a year to fully recover to be normal again after that surgery. And ultimately what happened is that I began hemorrhaging because there was so much cutting from the myomectomy experience. So that was the first myomectomy, just that alone. Yeah. So if you fast forward to the second time I had a myomectomy, which was actually very recently, my husband and I had been trying to conceive for a couple of years, and I was given a let me start over. My husband and I were trying to conceive. At the time, I was given a 0.1 chance of conceiving a child. We tried conceiving naturally for a couple of years. And again, my husband and I were both entrepreneurs. We did not have the financial resources to pay for in vitro or any other types of treatments at the time. So we basically prayed about it. And so 3 years later, I educated myself more on fibroids. I read books, I surfed the internet, I sought out other physicians and asked them questions, and I started to really learn about the body and how the body works with diet and with exercise, and I tried to live a healthier life. So I changed my diet, and I was able to conceive in 3 years after we had tried. I was actually able to conceive. However, I didn't know I was pregnant until I was having a miscarriage. So during the course of that miscarriage, it was very painful because my body was contracting out all the tissue. So the doctors felt that I just needed to contract everything out. So I was basically in contractions for a week. So I was just blown away at the fact that I had gotten pregnant. So I kind of relished in that instead of being really sad at that moment. So I said, if I did this, I can do it again. And so I focused more on my diet and exercise, and I got pregnant again in September of later that year. And we stayed pregnant for 6 weeks, and unfortunately, because my fibroid tumors had returned, we lost the child again. So that's been my journey with fibroids thus far. But I have had a second myomectomy. I had a robotic myomectomy, another cut, more weight gain as a result of that surgery, more fatigue, more time off work, and so here we are now, and I'm finding out about UFE, and had I known in 2008 about UFE, we would have started there.
Thank you very much for sharing your story.
Sure.
It's mind-boggling. I'm sitting here, and I cannot believe that what I know, what actually many people know, is not available to majority of people. So let's start from the beginning. You went, and we'll just discuss your story in a few parts. You went to multiple doctors, right? They told you have basically two options, myomectomy and hysterectomy. Nobody mentioned uterine fibroid embolization.
No.
Okay. Uterine fibroid embolization is available for more than 20 years from late 90s.
Wow.
It's done by interventional radiologists, not gynecologists. And it basically, through no incisions, through needle, either at the wrist or groin, tiny 1 millimeter in diameter catheter is inserted, goes towards the origin of the artery that feeds fibroids, and those arteries just embolize closed. As we close blood supply to fibroids, they dry out and absorbed by the body. Procedure takes 20, 30, 40 minutes. Hour, 2 hours, patient can go home. That's the miracle that I learned, not in medical school, not when I was a heart surgeon, not when I started vein clinics in many states, when we had interventional radiologists who did it, because it was hard for me to understand how is it possible something unique and amazing almost nobody uses. So as a heart surgeon, I don't really believe miracle stories. I would like to see it, and we did it. and again, and again, and again. It came right every single time. So that's what started me thinking. If we know something that can save the world, really, I don't know how that can be overstatement. If we can save millions or tens millions of women and not do it. So that's why we started USA Fibroid Centers and we started Fibroid Fighters. So you went to many doctors, nobody even mentioned.
No.
Did you ever think why?
Later on, once I found out about the procedure, absolutely.
Why do you think nobody ever mentioned?
Personally, from a patient standpoint, I think it could be financial. I also think that it's also because of the practice of the physician. If a physician decides that they want to specialize in a certain treatment, then they're going to continue to push that treatment and maybe not seek out other treatment options. So there are a variety of reasons I think that could be personal to the physician or just something that they're just used to.
We're all human. Physicians are human too.
Absolutely.
If we used to do certain things and nobody tells us, listen, time to change, it's very natural, I guess, to just go ahead with this line of work and not to change.
Absolutely.
As a heart surgeon, I learned how things change. Procedures that were done by heart surgeons became common procedures for cardiologists, and that's okay. From coronary artery surgery to valve surgeries, things get smaller. First surgeries, then minimal invasive surgeries, that minimal invasive percutaneous procedures through the needle stick. That's norm. That's called progress. And I think it's a time for progress in gynecology and fibroid treatments.
Absolutely.
42 out of 1,000 patients, women, are hospitalized every year for fibroids. 0.5%.
Wow.
Within a year, almost half get some kind of treatment. 66% hysterectomies, minority myomectomy, maybe 1% UFE.
Wow.
So start from kind of big picture. 40 million have fibroids, 10 million severe symptomatic, 500,000 hysterectomies are done every year, mostly for fibroid disease, for no particular reason. But, this 9.5 million continue suffer
Absolutely.
severely, and 30 million suffer. So when we have a miracle pill, or I don't know, treatment, tool, something that we can help tens of millions of people, this treatment needs to be applied.
Absolutely. That have only resulted in multiple myomectomies or hysterectomies for women. It's really disheartening as a patient to think about that when the UFE procedure exists, and it's, I won't say that the financial part of it is the only reason, because as we discussed, doctors are people too, but just from a patient standpoint, it's scary to think about that. I don't want the next generation or the generation after that of young girls to go through the same thing that I went through, that so many other women experienced. That's why it makes it so much better that UFE is something that's offered, because it's a non-invasive treatment that only takes 20 to 30 minutes. And having seen that treatment firsthand, because you've allowed me to see that treatment be done in your facility, I was shocked. The experience of UFE from the experience that I had having my myomectomies was night and day.
When we're talking about financial impact of fibroid disease, it equals to 25% cost of diabetes. And this astronomical cost comes from different reasons. Number one, it's very, very common. Number two, it's cost of everyday's life. Buying a female hygiene, buying medications, medical bills, from going to doctor, going to urgent care, hospitalizations. 42 out of 1,000 women every year go to hospital, actually hospitalized, not just urgent care or emergency room, hospitalized for fibroid problem. Cost of treatments, usually surgical treatments, myomectomy, hysterectomy. Cost of complications after treatment. Many treatments have complications. Then the absolutely biggest cost is the cost of productivity. In the business world, it calls absenteeism. People suffer so much they cannot go to work. In the real life, we can call it loss of opportunity. And that's very, very, very important. You know, you live once. You want to get the best life you can get, right? It's unfortunate that life was tinted very early with a fibroid disease, that you carry and suffer for 20, 30 years, and basically it robs you from good life. Imagine that there's a pill or solution or procedure that can be done less than an hour. Within 2-3 hours, you back home, and that's it. Your life is different. Would you go back in reverse and do it? Unfortunately, it's unrealistic to go back and then do what was done. But can you imagine that girls that's in 20s that know what's going to happen because we know the natural history of the disease? No, instead of suffering, they will choose, well, why not just take care of it earlier? It will not decrease chances of pregnancy and just rewrite future of their lives. And that's the idea. Why life without fibroids cannot be norm? In the United States, everyone likes beautiful teeth, right? You know, kids go to orthodontics, they get this fixed before high school because they want to look good.
Right.
How can you imagine impact of a little bit nice teeth and impact of not being robbed from your whole life from fibroids?
Right.
And you don't need to go month after month and it's 3 years process. Just go for 1 hour.
Yeah.
It's crazy not to use it. It's impossible not to think about it. You say, no, it's okay. You know, old way is a good way. Why? 100 years we were doing hysterectomy, everything was fine. Nobody asked us to do anything else. So I have this knowledge. I've seen it firsthand. When we evaluated 3,500 of fibroid embolization, uterine fibroid embolization that were done in our organization, we found less than 1.2% required repeat procedures. And we're talking about ambulatory, in-office procedure. Let's do comparison. Almost half of women that diagnosed with the fibroids very quickly get treatment. 66% hysterectomy. What does it mean? No more babies. We get the calls from patients, I'm 26 years old, I bleed so much, my gynecologist recommends hysterectomy, I don't have kids, I'm not even married. Do you have any other options? On a daily basis. How can gynecologists recommend hysterectomy to someone like this?
Right.
Then many women get myomectomy. Myomectomy is not really a minimal invasive procedure. That's a lot of cutting.
Yes.
That's a lot of cutting, a lot of bleeding. And within 5 years, majority come back. So you need to cut again. So the idea is, because you have tumors and you bleed, it also, number one, a risk factor, a cause for miscarriages. So if you shave it, remove it, maybe things will be better. Reality is a lot of bleeding. What's interesting, in African American population, the rate of hospitalization is 3.5 times higher than whites. Myomectomy is 6.8 times more than whites.
Wow.
And hysterectomy is 2.5 times. And risk of complication, 2.5 times more in African American. And risk of blood transfusion, 2.5 times. as we discussed before, unfortunately, the fibroid hits African American women earlier and stronger than white. So all the best years are wasted.
Yes. And
So-
I think about too, when you say all the best years are wasted, I think about those childbearing years that I had before age 40, because now I'm past age 40 and conceiving just naturally alone without the fibroids has lessened during that time. And when I think about, the loss that I've experienced in the past couple of years, it was stressful. We were newlyweds, so that was something very stressful for us to deal with as newlyweds, having to lose 2 pregnancies in 1 year. And I just can't express how much stress that puts on women in general, just myself, but just any woman in general. That level of stress is daunting, because stress also affects our bodies. Stress affects our core. So if I have a core that is distressed from fibroid tumors, and
You
I've
cannot
experienced-
function.
Exactly.
You cannot function.
Exactly.
So what's done, right? What can we do now, you and me, to change the world?
Yes.
And I think that's very, very important, because sometimes you think, I have an idea. And you try to think, how do we do that? And you think about obstacles that's impossible, like no available technology, things just beyond the reach. There's no obstacle here. We know how to do the procedure. 20,000 doctors, interventional radiologists know how to do procedures. Medical insurances and most of Medicaids cover the procedures. So what prevents us from doing the procedures that patients just don't realize that they need it? They go to the doctor, they don't do those treatments, and they get no advice to do these treatments. The doctors that do these treatments, interventional radiologists, the doctors without patients. Women don't go to interventional radiologists typically for advice. They don't even know the name of the specialty.
Right.
Many doctors don't know the name of specialty. So that's why I think if we'll bridge this gap by providing information, there's amazing treatment available, the great heroes of medicine called interventional radiologists, that they can do it in the office and use standardized approach that's proven in certain organizations. It will make the whole difference in the world. Imagine education in school. Obviously, they have health classes, right? They talk about many things, sex education, about pregnancies, about periods. If we'll add to health education in schools, topic of fibroids, that would be amazing.
Yes.
I have twin daughters. In the last year of school, when they were high school and now they're in college, they went to a few schools in the south side of Chicago. And I presented information about fibroids to girls that they called principals of a few schools. One of them or two of them agreed, and that was really interesting experience. Majority of girls didn't know. But then my daughters explained the symptoms, the signs of the disease. I said, oh, my sister has it, my mom had it, my grandma.
Wow.
Oh yeah, all of them had a hysterectomy.
Yeah.
That's unbelievable.
Yeah.
So we need to find the name for the problem. Just name the problem. I think realization that you have a problem, that's something that people, as you said, normalizing pain. It's not normal. It's half of the battle.
Right.
So you know, it's abnormal. I don't have to suffer. There's a better way. Second half is, how do I get help? And what help? And I think, amazingly, without too much problems, if you and I will speak more about this and maybe ask people that see this particular conversation, will share with everyone they know about fibroids. I don't know, send YouTube or share this, or just ask Google Uterine Fibroid Embolization or Fibroid Fighters.
Absolutely.
That will be tremendous step forward.
Absolutely.
great help to millions.
Yes, I agree. Dr. Yan, thank you so much for explaining the importance of seeking treatment options that fit the specific situations that I've been through, that so many women have yet to go through and are going through. I think that UFE is something that is groundbreaking, and it's something that I think has been suppressed far too long. And I think that if women who are experiencing symptoms like we've discussed, I really think that if they take the opportunity to do more research, look up uterine fibroid embolization online, and or even seek you out online, I'm sure they'll find what they're looking for. So thank you for the work that you're doing. I look forward to continuing the fight with you, and we're going to win.
Thank you very much, my great fibroid fighter, and hopefully many will join us. But I can assure that's absolutely possible, and will get better world and better life for women that suffer from fibroid disease.
Agreed.
Thank you again.